Hello, my name is Mary Hibbard. I'm a professor of rehabilitation medicine at Rusk Institute, New York University Medical Center in New York. I'm here today to discuss the American Board of Rehabilitation Psychology, one of the specialty boards of ABPP. I have been on the board for the past 10 years and have helped many people through the process of gaining certification. What I'd like to do is highlight first the focus of rehabilitation psychology. Its area is really specialized in working with individuals with acquired or congenital disabilities, the focus of which can be physical, cognitive, emotional, psychosocial. The goal of work in this field is really to bring the person to maximal adjustment to their disability and to help them with community reentry. The rehabilitation psychologists work in many areas. We work in inpatient and outpatient and community-based rehabilitation settings. We work in the military. We work in private practice. We also see a variety of individuals with physical disability. We will see individuals who have experienced stroke, spinal cord injury, traumatic brain injury, any other acquired neurological diseases. We will work with individuals with cardiac conditions, with cancer, with adjustment to lifelong chronic fatigue syndrome, Lyme's disease, just to name a few of the diverse areas that we work. Board diplomates in rehab psychology will work in private practice, or they will work in anywhere from acute to post-acute settings, working with either very specialized groups of individuals or very much more a generalist. One of the questions you might have is this the board for you? Well, there are some basic questions that you should ask yourself. First, are you working with individuals with disabilities? Is that your primary focus? Are you dealing with these individuals in domains of assessment, treatment, consultation, and advocacy? Four major areas of focus for rehabilitation professionals. Are you advocating for these individuals? Do you work in an education setting where you are teaching and working with students in the field and teaching them how to work with individuals with rehabilitation needs? If any of these questions are ones that you can answer very comfortably yes to, then this is probably the board for you. Now that you've made a decision that this is the board that you want to pursue, what's the process like? Well, there are lots of questions that people ask. And some of them are on the frequently asked question on the website that you can review. But let me highlight a few that I find are the most common. First that is often asked is, I didn't have an internship traditionally in rehabilitation psychology. Or, I never trained in rehabilitation psychology but ended up there almost by accident and now have loved it and worked in the field for many years. Can I sit for the boards? Well, the answer to that is an individualized review of your own specialized credentials, which is phase one of the process of credentialing. The examiners will look at your experiences from your externships all the way through postdocs, as well as your clinical experience in the field. All of those will be carefully weighed to determine your readiness to proceed on to the rest of practice sample preparation and oral exam. Another question I will be asked is, I specialize, I only see one type of individual. How can I possibly address all the competencies that are required of the rehab psychology credentialing process? One of the answers is to work very closely with a mentor. A mentor is a person who is related to the board, probably on the board, who is very up to date on what the process is involving. They will help you select cases, even within your specialty, that will be able to pull apart and illustrate your maximum competencies. They will help you select patients of different ages, different ethnic backgrounds, different presenting problems that will help you be able to illustrate how you are a competent rehabilitation psychologist. Other questions that I will get will focus on how long is it going to take? Is this a long process? Well, the average time it takes to finish the process is anywhere from 18 months to 24 months. I traditionally encourage people to pursue the ABRP process when you have identified several rich patients that you would like to be sharing as part of your practice sample. It's often a way to help focus the process and move you forward. Another question I will get is, where do I find a mentor? You've mentioned mentor. What is a mentor? The ABRP was one of the earliest groups to utilize the concept of a mentor to help the person, the candidate, through the process of practice sample review, selection, writing, and then through preparation for oral exams. The mentor does not participate in the actual review of the practice samples, but really serves as your advocate so that you can show your professional abilities coming through in your writing style as you describe your work with a patient. I strongly encourage the use of a mentor. Next question I'll get is, so where do I find a mentor? Well, mentors can be selected from people that you may perhaps know that are ABRP'd, but you will be asked to discuss that with the Vice President of the ABRP board. They will help you decide whether that's the best person for you or someone else who might have more related skills on the board themselves to serve as your mentor. I think those are the major questions that get asked. All individuals going through the ABRP will be part of a three-step process. The first is the specialized credentialing that I've spoken of. The second will be the practice sample, which consists of 2 clinical write-ups, maximum 50 pages, including some supplementary materials. And the third will be the oral exam. One of the hardest challenges in the process, and certainly known to many people in the field, is getting through that practice sample. And the question is why? Why is that the difficult bottleneck? Well, because the expectations are that by the time you submit your practice samples, you're showing a real good range of competencies across the 2 practice samples. Each practice sample doesn't need to have every competency, but across them they need to be able to illustrate your abilities in areas of assessment, intervention, consultation, ethical concerns. The supplemental materials that are needed for the practice sample are solely to document a validation or corroboration of the practice sample materials themselves. Your mentor will be very helpful in helping you shift your set from writing about a patient to writing about your reasons for why you intervened with the patient as you did. Hopefully you'll be able to use that mentor and move through the process of the ABRP board credentialing process to completion at a very quick rate. And good luck.